Welcome to another almost another episode, but really another webinar in our series of webinars as part of Food CoVNet. I'm Dr. Ben Chapman. I'm a extension specialist and professor at North Carolina State University, and I'm a director of the Food CoVNet project. I'm really excited for today's webinar, really to have just an engaging conversation around international perspectives in transmission of SARS-CoV-2 in food settings. Just to give you some background, the long-term goal of our project at Food CoVNet is really to reduce COVID-19 impacts within the food system. And we do this in a variety of ways, including laboratory experiments looking at the transmission, transfer, inactivation, and persistence of SARS-CoV-2 in food settings and on food contact surfaces. But also, we do a lot of outreach and communication and training work as part of this project, and also engage really heavily around issues that the food industry and regulators are seeing around SARS-CoV-2. Our project is housed at NC State University, but we have collaborators at the University of Florida, Rutgers University, as well as the University of Nebraska Lincoln. And today, one of our speakers is actually one of the co-PIs on this project, Don Schaffner from Rutgers University. Today's speakers, and I'll pass things off to them here shortly. Today's speakers come to us from two slightly different perspectives around the concept of transmission of SARS-CoV-2 in food settings. And our first speaker today is Dr. Ben Embarek from WHO. And our second speaker is Don Schaffner, as I mentioned before, from Rutgers University. I'll introduce Peter, but to give you a sense of what I've asked both of our speakers to do is really to give their insights and their perspectives based on really experiences over the last 18 months in investigating and also communicating about SARS-CoV-2 in food settings. Dr. Peter Ben Embarek is a food safety scientist at the World Health Organization. He provides technical advice on food safety issues. He has an MS degree in food science and technology and a PhD in food safety from the Royal Agricultural and Veterinary University of Copenhagen, Denmark, and has been engaged in the sector for over a decade. And Peter is someone who I've known for quite some time through the International Association for Food Protection, and he, many of us have seen him speak and talk about his experiences at WHO, especially as it relates to SARS-CoV-2 origins and investigation. And I really like, I'm really happy to invite Peter to speak today about his perspectives and experiences. So I'll stop sharing my screen and stop my video and turn things over to Peter.
Thank you, Ben, and also thank you, Don, for sharing the stage today with me. Exciting topics, good choice for sure, and I'm sure we'll have some good discussion today and some interesting questions from the audience. My take on the subject today is I'd like to go through the different phases of the pandemic in terms of how we looked at it from a food perspective, because that has changed over the past year and a half now. You remember early on, the first couple of months, we were all learning about COVID-19, trying to understand where it was coming from, what virus this was, and trying to understand what are these coronaviruses, what they are doing, where they're coming from, how to deal with them, etc. And at the same time, watching it spreading all over the planet with some dramatic period. Wuhan was one, northern Italy was another one, and then the rapid spread across the planet continued that. And early on, for everybody, it was clear. We all made the link back to SARS-1 back in 2003, and also to the other well-known coronavirus, MERS, the Middle East Respiratory Syndrome virus that was emerging in the Middle East in 10 years ago. And in both cases, these were linked somehow to the way we interact with animals. These are viruses that are have the natural niche in bat population. So everybody was thinking, oh, clearly that's a zoonotic transmission. It probably came to us either directly from bats or through another yet unknown animal, and possibly a food animal. So that was the first concern with our food, is that could it be a virus that jumped to us through the way we produce food, the way we raise animals for food, knowing also that in China over the last decade there have been a huge push for developing an entire new industry based on raising new species, wild animal species for food, and transforming them into domestic species. And then we heard about human-to-human transmission, and we heard about, be careful, you have to protect yourself, you have to wash your hands all the time, because as soon as you touch a surface that is contaminated, you may get infected. This virus is transmitting also through fomite, that is a true surface-to-surface transmission. And therefore, everybody started to talk again, linking the two things. Okay, can I get this virus when I'm out shopping, when I'm out touching things, and then naturally people were more and more worried about their food supply, because increasingly that was the last activities that many people were engaged with. They isolated themselves more and more, and they were left with either going to the pharmacy or going to the supermarket or the local shop to buy food, because these were basically the two only essential services that were allowed to stay open during the long lockdown periods. There was this growing concern, can I get this virus when I'm out shopping for food? Can I get the virus when I'm touching foods? What about apples? What about bananas? What about this and that? And then naturally, if the virus is on the surface, if I'm told I should be careful about touching surfaces, because if I touch a surface contaminated with the virus and then I put my fingers in my nose or my mouth, I can get infected. Can I also get that through consuming a contaminated piece of food? So that was a natural move in the mind of people on developing that growing concern about the link between this virus, which was and is a respiratory virus, and the link to our food supply. Then we moved into this dramatic lockdown period where entire cities were locked in many countries, where people stayed at home, and again the only essential services were pharmacies, medical supply, hospitals, and the food supply, because people had to continue to food. Everything else was closed. No shops, no shopping centers, no entertainment, etc. And that brought another key aspect up, which was the realization of the strategic nature of our food supply. We were extremely worried and dependent on a well-functioning food supply that could deliver food to these large urban population, because the next thing you don't want during a lockdown is that the people start rioting because they are getting hungry and can't buy food. So ensuring food supply, ensuring that factories were safe, ensuring that the distribution chain were safe, that the staff in supermarkets were safe, etc., was becoming a growing concern. And that's where we, together with FAO, issued a couple of guidance documents on how to maintain a safe supply environment and how to avoid having people handling and working along the food supply chain becoming sick or infecting each other, or even contaminating food, because that would be dramatic. And that was at the same time where one of the main recommendations we had to avoid getting infected was to avoid contact with other humans, because this being a respiratory disease, we could only avoid infection by avoiding coming in contact with other people who were potentially infected. And that was very difficult in supermarket environments, in shopping environments, because there you are with other people. So the whole logistic and the whole organization of movement of people in these food delivery environments became also a growing concern. And that also took a lot of time to explain again that a few basic things were necessary and enough to protect yourself. Washing hands, staying a little bit away from each other, and wearing masks were enough to protect yourself and your environment. And therefore, shopping could turn into a safe practice, and you shouldn't worry too much about doing that on a daily basis. So we managed after a while to get that message across, but I'm sure Don will talk more about the messaging part of this evolving story in a moment. For us, the next big thing was then when we saw the size and the dramatic turn of events over after half a year, seeing that pandemic growing and looking at having no end in sight, we all started to look at the origin of it. Where was this coming from? How could it possibly happening in a modern environment? And could we learn from that emergence of this virus? And could we do something to avoid another one like this in coming years or the next within the next decades or so? And that's where the whole work and efforts into understanding the origin of this virus came up, and I was involved in developing studies and plan for how to go about identifying or understanding the source of this virus, working with Chinese scientists and international scientists in designing the necessary studies to get us there. And that's where I was about going back to the source, going back to where we had the first sign of this disease, the first human cases, and then try to work backwards and try to find out how the virus made the jump from its natural, original bat niche, ecological niche, into the human population. Did it happen directly? Did it happen through another animals, and so on and so on? And we designed a series of epidemiological studies, a series of studies into the key markets in Wuhan, in China, where many of the first cases were linked to try to understand, did we have particular animal species, live species traded in that market? Did people get into contact with live animals in that market? Or did people bring the disease in the market and the market just served as an amplifying environment for the virus? So all these questions were up in the air and the subject of many discussions and subjects. And unfortunately, we still don't know exactly what happened at that time. We're still working on it. We're still designing additional studies. We learn more about what happened at the beginning. We understand that the virus was circulating quite a lot in December 2019 in Wuhan, including in the Huanan market, which was a huge market, not so well maintained, not so modern, even though it was in the middle of a huge modern city of 11 million people, still poorly maintaining traditional market. Not much sign of trade of a lot of live animals, but potentially some live animals were traded there. But frozen products were traded in large quantities, and in particular, products coming from farmed wild animals in southern China. And that's where the link back to these farming activities of new species became again of interest, and are still of interest, and we still need to look into that source, because these farmed wild animals are probably holding part of the story. And then in 2020 and also 2021, countries like China, who had managed to get rid of the virus in the human population, have been doing everything they can to keep it out of the countries, and that has been the case, and is the case for countries like China, Australia, New Zealand, and a few others who are in that situation where they have eliminated virtually the virus at home, and now are focusing on making sure that it doesn't get back again. And it can only get back in the country through infected people or through contaminated goods or animals. And that's where all the efforts of these countries is on controlling the borders and making sure that what comes in is being checked and controlled and quarantined if necessary, etc. But there, China came to the realization that on some very rare occasion, contaminated frozen goods, when opening and handling containers that had been sealed directly from a production site elsewhere, were found to be contaminated. This is still a controversial issue. It's still not clear if it's at all possible to get infected by handling contaminated products. There is no doubt that products can be contaminated because the virus remain viable for a very long time in the conditions you find in a sealed reefer container with constant temperature, no constant humidity, and no lights. That's ideal conditions for this virus to remain viable. But whether this is enough to infect somebody who handled this product, that remains to be demonstrated. But we have studies showing that the virus is capable of remaining viable under these conditions, and therefore it remains an interesting topic, and should be the subject of, in my opinion, of much more interest from the science and research community to better understand this virus from a persistence point of view and infectivity point of view. To what extent can people get and are getting infected through fomite and through handling contaminated goods and the like, because this is a critical issue and will be becoming increasingly a critical issue as we slowly get rid of the virus and slowly eliminate it from our environments, because there these last transmission routes will become suddenly of interest if they are viable once the traditional human-to-human respiratory transmission will disappear. So we should engage in much more research to understand that part of the equation. So still a very fascinating virus, fascinating story, despite the fact that it's also a horrible story. It has really affected the world in such a way that was totally unimaginable a few years ago, and we all know people who have been infected and suffered from that. So I think it has affected all of us, and we should never forget that, because these viruses can still come back. They will come back, and we have to do everything we can now to understand how they emerge, to make sure that we understand these factors, these processes that trigger emergence of these viruses, in particular at the human-animal interface, where we handle and produce animals for food, because that's often where these viruses are making the jump. A very good example, again, a little bit different, not related to food, but related to the emergence and the spillover part of it, is the transfer of the virus from humans to mink, and again back from mink to human in the Netherlands, and particularly in Denmark last autumn and last summer. There we witnessed live, in fact, the first spillover of a virus from an animal population. In that case, it was within mink farms, from mink back to humans, and how it was able to quickly mutate and jump on many occasions back to the human populations. Most of these new variants were not viable and did not go further than a few cases. But we were able to see for the first time what happens when you allow a virus to circulate in an animal population and get closely in contact with these animals as us human beings, and how we get infected through that way. So that was fascinating as well to see. My time is getting close to 20 minutes, so I think I will stop here. I got through the whole story, bringing us back here. The last thing I wanted to say is that what was also, and is still extremely important, is that we saw many large outbreaks, in particular last year in food factories, and in particular again in factories handling and producing cold or refrigerated or frozen products, meat in particular, and the transmission there was and has been in the vast majority of cases linked to the poor hygiene and working conditions of the workers in this environment. And that's again another lesson learned, I think, from these events, is that we have to revisit the way we produce food in many of these food factories to make sure that we provide environments for workers that will not pose a risk for large outbreaks, because we have seen many of these factories had to close, and many of them have shut down and disappeared because of these outbreaks, and that has shown how vulnerable our food supply is to that kind of viruses and outbreaks, and we have to make sure that doesn't happen again as well. So another area for research and investment in understanding how to better produce food in a safer environment for the workers, but also for all of us. Thank you very much, Ben, and back to you.
Peter, thank you so much. And when I do these webinars, I always forget before I introduce our speakers that we have plenty of time for question and answer. And there's already a few questions coming in for Peter. We're going to hold those to the end. We really like to have an engaging conversation after our speakers are done. But please, if you're in the audience, feel free to use either the Q&A function on Zoom for question and answer, or just type your questions directly into the chat. We'll be able to manage both of those. So anyway, Peter, thank you so much for your insights, and it certainly is just a very compelling and unique story, your experiences over the last 18 months. I'll move to our second speaker, someone who also know very, very well, Dr. Don Schaffner. I'll read from the bio that he sent me, but I'll also add some editorial comments in here. Dr. Donald W. Schaffner is extension specialist in food science and a distinguished professor at Rutgers University. His research interests include hand washing, cross-contamination, and quantitative microbial risk assessment. He's a fellow of the Institute of Food Technologists, the American Academy of Microbiology, and the International Association for Food Protection. Dr. Schaffner was president of IAFP in 2013 and 14. In his spare time, which is not much, he co-hosts one of the greatest food safety podcasts out there, Food Safety Talk, and then the other really great food safety podcast, Risky or Not. And I say that with all bias intended. Since the start of the pandemic, he has been interviewed for TV and print media, including the New York Times, Washington Post, and Wall Street Journal, on SARS-CoV-2 and the risks of COVID-19. So Don, we'll turn the floor over to you. And thanks for joining us today.
Yeah, thanks, Ben. I'm going to share my screen. I did prepare some slides just to mostly help me sort of stay on target and on time. So I talk at about 2 minutes a slide these days. And so I've prepared about 10 slides, which should keep me at about 20 minutes or so. I had a much longer presentation. I've cut this down quite considerably because I really feel that most of the value from webinars like this would be the Q&A with the audience. And so I want to be sure that we leave ample time for that. I do want to talk briefly about some of the stuff that I've been doing on social media. I was quite active early on in the pandemic. This is from more than a year ago, March 26, 2020. This was a tweet that I put out there, a tweet thread that actually went viral, talking about a YouTube video made by a medical doctor who was wearing scrubs in his home kitchen, which he was teaching everybody how to use aseptic technique to disinfect their groceries when they brought them home from the grocery store. Needless to say, I thought this was a lot of nonsense, and I felt it appropriate to call this out. And indeed, others felt positive about my message, and so retweeted it or liked it or commented, and actually got a comment from a number of people saying, "Thank you so much. I was really going to give myself a nervous breakdown scrubbing down my groceries. Thank you for giving me permission to stop doing that." I got a lot more stories I can tell about my interactions on Twitter, but in the interest of time, I'm going to move along. One of the things that was of interest quite early on, and this is a screen capture from a manuscript that was one of the earliest ones on virus survival, published in the New England Journal of Medicine by Van Tormelen et al. And we heard a lot of discussion about how long does the virus live, or how long does the virus survive on surfaces. And I don't want to get into a discussion about whether viruses are alive, but let's just say, for the sake of discussion, let's talk about virus survival over time. There was some early discussions of PCR testing on a cruise ship that found the virus after 17 days. One of the really nice things about this Van Tormelen article is that they used TCID50. They used actual infectious virus rather than PCR to do their quantification. But it's also incorrect, I believe, to talk about how long the virus survives, because even if you're measuring infectious virus, TCID50, it's not about the time. It's really about the starting concentration, which you can see very clearly on the graph is between 10 to the 3 and 10 to the 4. It's about the limit of detection, which you see very nicely illustrated on this graph with the dotted line. And then really it comes down to the rate, right? So, and then one of the really nice things that they did in this manuscript is they talked about the half-life of the virus. Now, for food microbiologists like me, we would rather talk about d-value, that is the time for a 1 log reduction. But the good news is that if you know a little bit about math, you can actually convert back and forth between half-life and d-value. And so the data that they produced was actually quite relevant to helping us think about the risk from surfaces and about virus survival. We got involved fairly early on, and thanks to some French colleagues of mine, at least one of whom is on the call today. So thanks, Laurent, for inviting me to be part of this and for being on the call today. They started collecting data on the effect of temperature on coronavirus survival, looking at SARS-CoV, SARS-CoV-2, as well as a number of other coronaviruses. And what you can see here, and again, this is going to look familiar to the food microbiologists in the audience, this is the type type of plot from which you would normally get a z-value. What you can see here that the d-value as a function of temperature is not exactly linear, it's actually curvilinear. But you can see, generally speaking, these do vary by orders of magnitude there, but the coronaviruses as a family, as a group of viruses, behave relatively similarly. And then, of course, the effect of whether it's on a liquid or in a surface makes a difference as well. But one of the earliest things that we knew was that temperature matters in terms of looking at the survival of the virus, and we'll come back to that. So that's kind of the end of my historical reflection. Again, there's a lot more I could say, but I'd rather look forward and get to the questions. I do want to share some great resources. One podcast that has been of great value to me during the pandemic is This Week in Virology, or TWIV. I was a regular listener. I've since be busy with other things. I'm not listening as much as I used to. They get a lot of things right. They get some things wrong. I've repeatedly tried to correct them around their understanding around dose response with no real success. But I want to call out a couple of recent episodes that I think are really quite good and would pair quite well with this webinar. And the first one is episode 760. The hosts of the show interview 3 other people that were there in China, boots on the ground with Peter Ben Embarek, that's Peter Daszak, Taya Fischler, and Miriam Kopmans, and they basically talk about their experiences investigating the origins there in China. And so it goes on for quite some time, but it's well worth your time if you're a fan of podcasts and you want to learn more about the WHO investigation. And then another really, really good episode that came out just a few days later is TWIV 762. With Robert Gary. And I had not heard of Dr. Gary prior to this podcast, but he has written, and I'm going to show you a screen capture recently from an article that he recently posted looking at the molecular biology of SARS-CoV-2. He talks about the idea that it, whether it came from a lab or whether it came from nature. And again, just some real good discussions there. The paper is beyond me, is beyond my detailed understanding, but I think it makes it an interesting story. And like I said, it's a great podcast. But I do want to share a little bit from Dr. Gary's manuscript. It's entitled "Early Appearance of Two Distinct Genomic Lineages of SARS-CoV-2 in Different Wuhan Wildlife Markets Suggests SARS-CoV-2 Has a Natural Origin." And you can see the diagram over there on the left. Looking at, and it's got pictures of bats, it's got pictures of pangolins, animal farms. And again, just basically the key punchline is what you see in the yellow box, yellow highlights there at the bottom. And this is the idea that fairly early on in the pandemic, there were 2 lineages of SARS-CoV-2 circulating. One in the Hunan seafood and wildlife market, and then another distinct lineage circulating in other wildlife markets. And Robert talks about this in the discussions on that podcast. So I encourage you to take a listen of this. And so whatever hypothesis we use to explain the origins of the virus, that hypothesis has to account for 2 distinct lineages spreading in different wildlife markets in that part of China. Okay, and as he writes here, a dispassionate science-based discourse must account for multiple markets that were linked to early cases and the divergence into 2 lineages. So again, take a look at the article, take a listen to the podcast. I find it to be really, really valuable in informing my thoughts. So in preparing my remarks here today, I looked at the title that we were given. Okay, so international perspective and food settings were two things that jumped out. And so I want to say, first of all, this is not an international perspective. This is just my perspective, just speaking as a scientist who's been following this relatively closely over the last year plus. So what is a food setting? Well, clearly, I think a food setting could be a wildlife market, right? And one of the, and in our preparations for this call, Ben and I spent some time talking about the importance of calling out the WHO guidance on live markets. We know that these live markets can be a risk for the development of or for viral crossover from animals to humans. And so I think these wildlife markets are not going to go away anytime soon. So what we need to do is to follow appropriate guidance and then to continue to revise that guidance as the science advances. So a food setting is probably a wildlife market. Peter made mention of the spread in food processing plants, specifically meat processing plants. Clearly, that is a food setting, right? That is a setting where there is food, where we have had spread of the virus. I'm not sure that the food is all that important. I think there's other factors that really come into play, which I'll talk about just in a minute on another slide. Are restaurants food settings? Well, to the extent that people have contracted the virus in restaurants, yes, that's a food setting. Is that a risky environment because of the food? No, again, I think it's because of other things, which we'll talk about in just a minute. Same thing with supermarkets. And then, finally, is my kitchen a food setting? Well, my kitchen is clearly a food setting. It's probably not a food setting where you can get COVID-19, especially not now, since there's only 2 of us that live in the house, plus 2 dogs, and the humans have been vaccinated. And so, and as far as I know, the dogs are not symptomatic. And so my kitchen is probably not a food setting where you might see coronavirus being transmitted, just because of the facts that I laid out. So what do we know? Well, we know that fomite transmission is very unlikely, and CDC has finally, as I like to joke, has finally come around to my way of thinking. I've thought for a long time risk from fomites is pretty unlikely, and CDC continued to press concern over fomites, but I think we really haven't seen evidence of outbreaks that are linked clearly to fomites. Or if we have, those outbreaks are very few and far between. We know definitively that cold temperatures enhance survival, and so to the extent that we have cold temperatures in food settings, we're going to see enhanced virus survival and virus spread. We also know that low humidity will enhance virus survival. And so those environments that are cold, that are also low humidity, will probably lead to increased viral transmission. We know that masks are protective. And so one of the things that we have to do when we eat food is we have to remove our masks. And so that's probably a big reason why restaurants are a place where you can get COVID-19, because you are taking your mask off to be able to eat food. The virus is shed in droplets and aerosols, and there's argument about what's a droplet versus what's an aerosol and what's the degree of spread, but I think the evidence is pretty clear that it's both droplets and aerosols. We can argue about the magnitude of each of those. And then some activities, coughing, singing, perhaps eating, just because you have a mask off and your mouth is open, those may enhance transmission. So anything where you're going to be breathing, especially situations where you're going to be perhaps doing physical labor and breathing heavily, that is going to increase the transmission of the virus based on everything that we know. The other thing, as I wrap up my comments here, I think one of the things that was necessary for the WHO report to do, but which has led to some concern or some controversy or disagreement, is they use terms like very likely pathway, possible to likely pathway, possible pathway, extremely unlikely pathway. Now we don't know the probabilities associated with those terms, and I don't think the WHO folks do either, otherwise they would have used numbers to express them. But what we do know is that very likely is more likely than possible, and then possible to likely is somewhere in between very likely and possible. So these terms, I know why they use them. These terms do convey meaning, but the problem is they're imprecise terms, and they may mean different things to different people. And so is it possible that an extremely unlikely pathway could be proven to be the quote unquote correct pathway? Well, yes, because there's no absolutes here, right? All of these are possible. It's just we're talking about probabilities, and we're not even talking about probabilities in the way that I like to as a quantitative microbial risk assessor. We're talking about probabilities in kind of a squishy way. So some final thoughts. You cannot prove a negative. We will never be able to rule out any of these possibilities, because it's just fundamentally logically impossible to prove a negative, because you can always say, well, what about this, and what about this, and what about this, and you can just keep on going. And then finally, although this may bother people, I feel it's necessary to say that we may never learn the origin of SARS-CoV-2, and I think we have to be okay with that. And as I was ruminating on that second bullet point, it reminded me of one of my favorite quotes from one of my favorite scientists, Richard Feynman. And I remembered the first part of the quote, but I forgot the second part. But when I looked it up, I was really pleased that I had done so. And let me just read it to you here. He writes, "I can live with doubt and uncertainty and not knowing." So, okay, that's my advice to you. You should get comfortable with not knowing. But this second one, I think, really points out why it's so important in this particular case. He goes on to say, "I think it's much more interesting to live with not knowing than to have answers which might be wrong." And so I think fundamentally, I think we will ultimately learn the origins. And I do think approaches like that proposed by Dr. Gary, looking at lineages, looking at evolution, looking at the time clock of these viruses, we should, through doing all of that, be able to pinpoint a starting point, and we may be able to pinpoint that spillover event, or that seminal event. We may not, but I think approaches like this are going to be key to doing that. And so with that, I will conclude. Thanks, Ben.
Great, thanks, Don. So I'll corral these the questions that are coming in through Q&A and through the chat. I'll invite Peter to turn his camera back on and his microphone, and we'll have a good discussion here. So the first question for Peter comes to us from friend of ours and friend of Food CoVNet, Jeff Farber. Peter, Jeff asks, what is the one thing that surprised you the most from your visit to China?
Good question. There was many. It was a fascinating journey, and difficult to pinpoint one more than the other. But one thing that surprised me, perhaps coming from a research and point of view, was that many of what I would think would have been obvious question to address months and months ago had not been yet addressed. Walking around discussing many of these topics with counterparts immediately and even before raised a lot of obvious questions, and you said, well, why is that obvious study not conducted yet? So to me, that was both surprising and also frustrating in many ways, that some of the key studies one would have thought should have been done immediately had not yet been done. There are many reasons for that. It has been a very traumatic event for the city of Wuhan and many of the people involved. They've been focused on many other issues. The response to the pandemic has taken a lot of resources and priorities and so on. But still, coming from where I was, that was probably the most surprising thing. Yeah.
Great, and just as a follow-up to that, Peter, a question that came in through the chat. Could you maybe elaborate on what you think the studies that have not been done could be that would help answer some unanswered questions?
Yes, there's still a lot of these studies that needs to be conducted and can be conducted. It's also important to note that even if a lot of time has passed since the emergence of this virus. There are still many studies that are relevant. We can still learn a lot from conducting these studies. In our report, we have a long list of recommendations to advance our understanding of all these hypotheses that we lay out, both the most likely and the unlikely ones. And just on that point, the way we try to rank these hypotheses was more as a kind of tool for prioritization of the recommendations. Where would we like to put most of our efforts in as a matter of priority in the coming months, rather than starting studies in all directions at the same time. So we wanted to try to have a logical way forward to explore one hypothesis after the other. And of course, if the most obvious one turned out to be nothing, then we would move to the next one and end up with the least likely one at the end, of course. And we also said that if new data on the way coming up of these studies or other studies done elsewhere would change our picture and a level of knowledge on these different hypotheses, we would of course revisit the ranking and the likelihood and the description of these hypotheses.
Great, thanks, Peter. Don, your hand is up. I will recognize you from the chair here.
Yeah, thanks. A couple of things that were mentioned on either one or both of those TWIV podcasts was that the Chinese scientists are preserving blood samples from people that were infected early on in the pandemic. And so to be able to go into those samples and find virus and then sequence that virus, I think is going to be key in understanding how it has spread and how it's mutated as it's evolved. And then I think the other thing that's really important that I would hate to see not happen is to continue to look for novel coronaviruses in these animal populations, right? There's just so much we don't know about these viruses, and these poor coronavirus researchers have been struggling for years and years to get funding to do this. I mean, part of the reason why the Wuhan Institute of Virology is where it is like this is where a lot of these animals are, and this is a high risk part of China. And so to be able to go out and to do that fundamental basic science, I think is so important. So those are a couple of things that jumped out to me as a bit of a naive outsider in listening to those discussions. Two things that seem quite interesting to me, personally. And then of course, as Peter said, I mean, let's look at the detailed recommendations. It's a very long report, and that doesn't even count all of the appendices. But again, it's a lot of work went into it, and I would encourage people, if they have the time, to read it.
Great. Don, there's a question here from Julia Sobolik. And so she asks, as we use QMRA approaches to estimate fomite-mediated risks, are there recommendations for communicating very low risk, i.e. risks that are 1 to 10,000, 1 to 1 million? The challenge seems to be to indicate risk is low, but will never approach zero. And this doesn't support the use of extensive fomite decontamination, et cetera. So could you weigh in on that a little bit?
Yeah, and one of the slides that I took out of my talk was a screen capture from an MMWR article that appeared, I believe, in March 2020, looking at an uptick in calls to poison control centers because people were overusing cleaners and disinfectants, right? And they were actually making themselves sick. And so part of, I think, the answer to your question is looking at it in terms of a risk-risk trade-off, right? Like the risk from fomites is low, we estimate on the order of blah, blah, blah to blah, blah, blah. But then what's the probability of making yourself sick from overuse of cleaners, right? And that's also quantifiable. And so looking at that risk-risk trade-off. But it's talking about risk and comparing risks is always tricky, but I think that we should always strive to, and the other thing too that I find sometimes helpful when you're trying to make risk-based decisions is to look at, okay, if I have these 5 risks, right? And then I look at the cost of mitigating each of those 5 risks, and I have a limited budget to mitigate risk, how should I allocate my funds? And obviously, I'm going to allocate my funds to those things where by spending a little bit of money, I can get a huge benefit to risk reduction, and then move on to progressively lower and lower risks as I spend my risk reduction dollar. And so I think that's also another very useful way to approach this. And indeed, some of the stuff that we're interested in doing through Food CoviNet, looking at helping restaurants decide whether disinfecting menus should be a priority. And I would say, unless you have a good masking policy in place, and unless you've investigated ventilation, probably not time to think about disinfecting menus. And that's just my sort of ad hoc qualitative analysis just now. But to be able to put numbers to that, I think might be really helpful.
Great. Well, I'm going to take a little bit of a turn here, and this question comes from Bruce Perkin. So Bruce asks if both of you could maybe postulate or speculate why we saw a lot of transmission in meat processing facilities, but maybe not so much in fresh produce processing facilities. Both have shoulder to shoulder. Oops, I lost the question here. Both are shoulder to shoulder employees. Both are chilled. Both have high humidity. Was the environment of working not so relevant, and the activity of behavior of employees outside of the work more relevant? I guess to weigh in on that question from all globally as well as here in the U.S. What are your thoughts?
I'll take a crack at it first. So I think that the fact that we have, so I guess one question is, was it really different, right? Like, we certainly heard a lot about meat plants because it's been in the news. So let's see if we can ground truth the statement, right? Is it really true that there was more transmission in meat plants, right? And then if it is true, let's begin to ask the question. And I don't know enough about either of those two environments to begin to say, but if there really were well and truly differences, then let's begin to look. Was it masking policies? Was it stay at home when sick policies? Was it ventilation? Was it, how different are the temperatures? And then, what were the activities of those workers when they weren't at work? What was done to mitigate the risk in community settings, association with those? All of those are really good questions. I don't think we know enough. We know enough to generate some interesting hypotheses. I don't think we know enough to definitively answer the question.
I think, yes, that we don't know enough about the difference to make to start speculating one way or the other. I think what will be extremely important is to understand the difference between these environments. I have the feeling that even if the conditions as Bruce described seems to be very similar, I have the feeling that there are still very big differences in the environment of these factories, the way the products are moving, the air, perhaps also the temperature. I'm not sure. The humidity. It's to me, there are big differences when thinking about these different environments, but absolutely worth exploring. I'm also not sure if the workers are the same in this type of factories, or whether there are differences there. In Europe, clearly, the meat factories were much more affected, but that's apparently very much also linked to the way the meat factories are integrated and run. And I'm not sure if we have in Europe at least the same type of integration in fresh produce facilities, but absolutely worth exploring further and to get a good analysis of these environments.
Great, and as a follow-up to that, there's I think a question that builds on the differences in handling here from Ricardo Adonis. Peter, and it's directed to you, but I think Don, you might be interested in weighing in as well. does it have a real effect to disinfect cardboard boxes after handling and before dispatch to some markets in a risk reduction standpoint?
I don't think so, because that's not where the risk is. If there is a risk, as has been illustrated by some high-profile events in China in particular, there it's the condition you find during long distance transport in reefer containers with stable temperature and humidity and no light that would allow a persistent viability of large number of virus particles. But as soon as you get that out, and that would only pose a risk for the frontline workers opening and handling these containers content. As soon as you start moving the content around and putting it in warehouses and moving them in and out, then the virus will lose viability very quickly because of the changing physical environment around those cupboard, both in light, temperature, humidity, etc. By the time the cupboard arrive at the retail level, there wouldn't be any risk for anybody, and particularly not at the far end of the chain when the products reach the consumers. So if there is a risk, it's really a very limited one for those who would open these sealed containers, but not beyond that. And there again, I think it, as we always have been preaching in food safety, it doesn't help to try to control the problem afterwards. You have to prevent it from the first place. So ensuring that you have workers free of the disease, that you don't have large outbreak in food factories, that you ensure that you have prevention procedures in place in your factories. That's what matters, and that's what we should preach and focus on, rather than trying to fix again the problem after it has happened.
And I'll just add, Ben, I think we need to clarify risk of what, right? If it's risk of having my product rejected because it contained PCR fragments of the virus, well, yeah, maybe disinfection is a good strategy, right? But it's not affecting risk of human health. It's just reflecting risk of having the product rejected or put on hold. So we have to get clear on what risk it is that we're managing. I mean, if it's a box that you can check that lets commerce keep flowing, even if it's not science-based, you're probably going to do it, right? Because at least it's been my experience, is that people will sometimes do stuff for, I hate the word optics, but people will do stuff for optics or to achieve something, even if it's not supported by the science in terms of actual risk to human health.
That's a really nice segue into the next question from Dan Vassar. And I'd like to hear both of your perspectives on this, because I think this may be a very US centric type of question, but I do want to hear Peter's thoughts here. Why do we see the rise of relaxing mask mandates or recommendations and not the relaxation of cleaning and disinfection of fomites in recommendations or practice? Is it doesn't seem to follow the science from a risk perspective. And so, Don, I want to get your thoughts on that, but also, Peter, I'd like to get your insights on if you're seeing this a similar relaxation of masks versus cleaning and disinfection globally that we are experiencing here, certainly in North America.
Yeah, so what I'll say, Ben, is, like, remember that there are the people who do the science and who talk about the science, and then there's the people that make policy, and they're not always, in fact, they're hardly ever the same person, right? And so the reasons may not have origins in science. The reasons may be something else. And so that's one point to think about. And then the other thing, the advice that I've been giving to folks is, like, you shouldn't stop cleaning, right? Keep cleaning as you were cleaning before the pandemic, right? Cleaning and disinfection, washing your hands, using hand sanitizer. These are all good things to do. You don't need to stop doing them. Just do them at the frequency that you were doing before. And then, I think that part of what maybe we'll see culturally change, although I'm not super optimistic, is a change around masks, right? One of the last countries I visited before the pandemic started was Japan, where they have an incredible culture around cleanliness and around mask wearing. And people wear masks when they feel that they may be getting sick and they don't want to infect other people. I would love us in Western countries, including my own, to have that switch flip so that we begin to see masks as a thing that we do out of courtesy to protect other people. So I didn't really answer the question, but I think the answer is it's not up to scientists, it's up to policymakers.
Yes, I think it's. I would agree with you, Don. That would be fantastic if we can, if we could adopt some of these cultural habits elsewhere. But I hope that there is not already now too much of a relaxation on the basic measures to protect us, and that's wearing masks and wash hands and keep distance, because these will continue to be extremely important in the coming many months, regardless of how the virus will continue to circulate at different levels in different countries, because we don't really have anything else to protect us. Vaccination is being rolled out, but it will take a very long time before everywhere a decent portion of the population is fully vaccinated. So let's rediscuss the use of these other protective measures once we have the entire population of the world vaccinated well and efficiently. Until then, we should absolutely keep using masks and washing hands and cleaning and disinfecting and keep distance as well, because it's the combination of all these measures that protect us. It's not one or the other. It's the combination of all these. Just missing on one, and we may as well drop the ball again completely. So it's important to get that message across again. In particular, as you said, we got a lot of new, very good habits during this crisis, and particularly in the food industry. It will be extremely important that we find ways to ensure that these habits that we have introduced continues, because the increased level of washing hands that we have seen in the past year have had a clear positive effect on transmission of certain foodborne diseases, and we should not go back to the old way of doing things. So everything we have invested in the past year and a half should be maintained and continued, in particular in our food producing environment.
Our next question comes from Sarah Sanders. In regards to both transmission and general well-being, can you give examples on how we can improve working conditions or worker hygiene in food settings? And I'll add, specifically for COVID-19, but there may be some spillover here into other foodborne pathogens.
I think it's part of much bigger reflection on how we produce food and how we see workers' health as part of that process of producing safe food. And whether we're talking about COVID-19 or other disease, whether they are foodborne disease or respiratory disease and so on, I don't think anybody would like to go and buy products in a shop, whether it's food or anything else, that is covered in zillion of bacteria and viruses of all kinds, just because people want to buy product that are not contaminated with all kind of stuff. So I think it's also important that we find ways and collectively decide that to upgrade the health of food workers as a key parameter in production of food. Again, because if we are talking about respiratory disease or the like of COVID that may not have direct impact on the food you produce, but have an impact on your food production chain and on the supply chain. We have seen in several places these large outbreaks in food factories having a clear impact, direct impact on food supply in many places, disrupting food deliveries and capacity of delivering food to in particular to areas where alternatives were not immediately present. So there is a risk to turn this into a food security issue rather than a food safety issue. And of course, at the end of the day, it's also part of the cost-benefit analysis. If you want to risk jeopardizing your entire production just because you don't pay attention to health workers, and it's also something we have to think about. But I don't think it's something that should be left only to the individual factories, because it's something that should be thought and decided and addressed collectively, because it will immediately turn into a competitive parameter in the way we produce food, and it's probably also part of this long discussion we've had about how cheap should we produce food and where should we cut corners and make savings in the name of producing the cheapest possible food. And at some point, we have to make choices, and this is clearly one we have to make. We know how to protect the health of workers. That's not rocket science. We have all the knowledge needed. It's just a matter of policies, regulations, standards, and again collective decisions. Would be a great topic for an IFP roundtable discussion.
Yeah, well, and as I guess a follow-up, do you know of any examples of governments? You kind of talked about sort of the collective, not leaving it down to the individual, but do you have any examples internationally of governments that are providing funds to help mitigate risks of disease transmission in food manufacturing environments, for whether it's reducing costs of technology or shoring up the workforce, because these supply chains are essential? Do we even have any examples out there of this happening? Because I think you bring up a point that has certainly been exposed as a problem and concern as we've dealt with the pandemics. And I know that this is something, Donna, you might want to weigh in from a US perspective here, but I'm not very aware of any examples like this. So are they out there and we just don't know about them, or are there governments around the world that are talking about this? There was a question in there.
Yeah, I don't think we've seen good examples where protective regulations or measures had been put in place immediately or were already there. I think unfortunately, we've seen the large outbreaks in food factories all over the planet, in both in very advanced economies and developing economies. So it has not been in any way linked to a level of development of a country or their regulations. And I mean, the most advanced economies and with what you would thought would be the most advanced food regulatory environments, we've seen this event happening, because again, this has been an area that has not been well understood and poorly regulated, probably, and has not been seen as part of traditional food regulatory environments. And companies, of course, have in some places by trying to outsource the workforce, for example, to other companies specializing in workforce management, coming from other sectors, has probably contributed to that as well. Again, as we discussed earlier, an area where we need to better understand the environment to understand what needs to be put in place and corrected, and what is already okay.
Yeah, and I'll just add to that, like the regulatory complexity of doing this, right? Like anytime you have problems that kind of sit at the interface of multiple regulatory agencies, it's always interesting to see what happens, right? So CDC is in charge of public health, right, and seeing what's going on in terms of the epidemic. FDA has jurisdiction over food plants that don't produce meat, USDA, FSIS over plants that produce meat. But then the other regulatory agency that comes into here when we start talking about worker safety is Occupational Safety and Health Administration, which is part of the Department of Labor. And so trying to figure out how you get all of these big bureaucratic regulatory agencies to move really quickly to solve a problem with a huge amount of scientific uncertainty it's just a recipe for trouble. What hopefully will come out of it is some work that helps them work better together, so that we have OSHA policies that are in sync with CDC guidance, that are consistent with the messages that you hear from FDA and USDA. But it's a tough problem to solve. No, but that's not a reason to not try to solve it. It just means we need to work even harder.
Do you think, and this might be out of all of our expertise, but do you think that there's a role in insurance, like premiums, and as drivers for this when it comes to worker health and safety here? Like, we're focused on the regulatory or government sort of sponsored actions here, but are there other business drivers that we might see?
Yeah, well, I mean, one of the things that I was contacted fairly early on in the pandemic from lawyers that work for insurance companies, and absolutely, like, what does it mean? What does it mean if you're shut down? Like, it's like looking at the nuance between, okay, well, like we understand sick building syndrome, right? And we understand that if there's stuff in the walls of the building that make you sick, there could be consequences to having a quote unquote sick building, right, with mold growing in the walls. Well, what about if it's not mold growing in the walls? What about if you're shut down because there's a pandemic and there might be viruses on the table in your restaurant, right? And so, yeah, and there's still, I imagine, a huge, we haven't really even begun to see the tip of the iceberg in terms of lawsuits coming from this. And so that's gonna come down. And so yeah, for sure, like getting a handle around what does it mean for insurance companies that are going to have to pay for, or will seek to get out of paying for some of these things. It's very interesting times. And yeah, hopefully, yeah, maybe, I mean, we've certainly seen with respect to foodborne disease, right? Like lawyers and insurance companies, including companies that are self-insured, like all of that has continued to evolve, since Jack in the Box, et cetera. And so this will have similar knock-on effects, I imagine.
I'm gonna move a little bit, going back to another question from Jeff Farber, and this is for Peter. From your experience in China, what data would you have liked to see but did not see because it either was not available or because of privacy issues?
We saw a lot, and of course, you as scientists, you always want to see more and have more and get more. Can never get enough. What we, for example, all the places we wanted to see, we were allowed to see them, and there was no restriction on where we could go and not go. So that was fine. Where we wanted to have more insight was in many of the raw data from a large number of studies they had conducted before we came. But like anywhere else, there are rules and regulations on sharing raw data for all kinds of reasons. That would be the same in any other countries. Usually, you would need to negotiate and make particular agreement to get access to certain data for certain purposes. And that takes time. And therefore, where we could not get access to the raw data, we ensured that that was put as part of the recommendation. So the studies where we would like to go back and this time look at the raw data are now in the recommendation part, understanding that getting these agreements for sharing raw data will take time, and therefore it's time was also an issue while we were there. We were there only for 4 weeks. So I'm confident that what we did not get in terms of raw data, we'll get it later on when we redesign the next round of studies, because then they will have time to get access to the raw data. And of course, there will be issues about the privacy parameters and metadata and so on, but that can always be fixed one way or the other. So I'm pretty confident that we'll get with a little bit of time and efforts, we'll get access to this raw data. Yeah.
Don, there might be data that you want to see from your trips to China. No,
no, but I want to also speak to Jeff's question as well as to Jeff's other question, which you may be studiously avoiding. And that is to say, Jeff, if you have got the time, I would strongly encourage that you listen to, especially that first podcast, the ones with the 3 other members of the WHO team. They talk about how it felt to sit across the table from their Chinese counterparts and ask for this data. And basically, the thing that stuck with me is they said, you know, they answered the questions the same way that we would answer the questions if we were on the other side of the table, right? And so to them, a gut check as a scientist, it's like, yes, they sound like a scientist like us answering the same question. And so there weren't, I mean, you can always be suspicious, but they were not suspicious based on the answers sounded just like a scientist would answer that question if they were asked that. And they also touch on the sick employees. But also, Ben, if I may, I have a question for Peter, and that, Peter, is about phase 2. Can you give us any update on what's going on with phase 2 and give us any sense as to the timing of phase 2? And you didn't specifically use the phrase phase 2, but you're talking about follow-on work. So can you talk a little bit about that?
We're still working on converting the recommendation that were made in the reports into a series of studies that will contribute to answering these recommendations. And we're also listening to input and recommendation from member states, from different governments, for different institutions, from all sides, to make sure that we have a comprehensive set of studies that will address all these concerns and recommendations, and bring us closer, hopefully, to the origin of the virus understanding. In terms of timeline, this is, as you can imagine, a process that takes a little bit of time. With just receiving input from member states and countries and discussing and so on takes a little bit of time. But we're getting there, so I'm hopeful that we'll soon be able to present a comprehensive plan for the way forward. But that's not an easy task, and unfortunately, it's good, of course, that there is a huge interest, continued huge interest out there for the subject, but it's not an easy one to manage and run in the current world situation. But I'm optimistic. I'm sure we'll get there. We just have to be patient, all of us, we'll get there. But it's important to also understand that it has to be in depth. It has to be led by science. It has to be following concrete lead. It has to be following data and so on, and not jump all over the place, because then we lose science, we lose sight of where and how to work, and it will be a mess, and we don't want to get there.
So Don alluded to Jeff's last question, or maybe not his last question, but the last one that we have currently on the list here, and it is for Peter. You sort of alluded to this a little bit in your comments, but how confident are you that employees of the Wuhan virology lab who became sick in November of 2019 didn't have COVID-19?
A difficult one.
Thank you for tackling it. It is a difficult one.
First of all, because we don't have any hard facts on cases of whatever, or even sick persons among the staff of these labs. There are several labs as well in Wuhan of different interest in that respect. So again, that will be part of future studies to, again, of course, follow these as many other leads to understand, is there something there that we should look into more details, or can it be explained quickly and easily by something else? So it's work in progress. It's something we will continue to look at, and yeah. That's where we are.
Good, and sort of as a follow-up, and Don, you ended up touching on quite a bit of this in your presentation, but I'll field Bruce Perkins' question here for the group here. Given the increasing rumblings around the virus being a lab product rather than jumping from animals, what are the facts, and what would we need to say in order to convince ourselves one way or the other? And again, I know, Don, you hit on this, and Peter, you've talked about it, but if as we wind down the webinar today, what 3 or 4 bullets can we re-emphasize for Bruce and others in the audience here? And Don, maybe we'll start with you.
Yeah, so a couple of things. So I think we need to separate from engineered in a lab to released from a lab, right? And again, I would encourage anybody who's interested to take a listen to those two. I hate to keep promoting these 2 podcasts, especially since they're not my own podcasts. Mine are great too, but as are the ones that Ben does, which are the same. But I mean, these are seasoned virologists, right? These are professional virologists, and there's some really great discussions around the possibility that the virus was engineered in a lab. And basically, it boils down to no intelligent virologist would ever engineer a virus to look like this. It just doesn't look engineered. It looks like it was random and it arose from nature. The more subtle point is, could it have been released from the lab? And I guess to Jeff's question, what's the likelihood that the 3 people that were sick in the fall were sick with COVID? Well, let me turn that around and say, what's the chance that they were sick with the flu, right? Because that is probably a more likely explanation. And again, I think that's Peter alluded to this, and again, they talked about it on the podcast. I think you have to go with what's the most likely explanation. I think the most likely explanation is that they had the flu, and that's why they went to the hospital. And then and look at the evidence that would have to exist for them to have had COVID-19, right? Either stuff would have, and people can always lie and cover up, right? But you have to say, well, what's the likelihood of that versus the other likely explanations? And so, again, I think Peter said it very well when he encouraged all of us to be patient. I don't think we get any benefit from a rush to judgment, and because ultimately we want the right answer, not necessarily a quick answer, right? And so I think I would rather have a right answer than a quick answer that's wrong. But that's just my own personal perspective. It's hard. But again, a lot of good discussion on those 2 episodes of TWIP. By people that are much smarter than me about even they don't understand dose response, but they do understand virology.
Excellent. As we wind down here, there's a couple of remaining questions. One from Bobby Cannon, and this is open for anyone, I guess, to talk about differences from a virology standpoint. But Bob asked, most important foodborne viruses are non-enveloped. Well, COVID SARS-CoV-2 is enveloped. What's the impact of passage through the stomach and exposure to bile on the envelope of SARS-CoV-2 infectivity and the likelihood of foodborne transmission? If either of you'd like to weigh in on that.
Yeah, I'll say I think it's incredibly unlikely that it can be transmitted by food. This is something that we've spent a lot of time talking about early on in the pandemic, and I think we're convinced that it could. Yes, and that's why the phrasing food settings, right? As Bob I'm sure knows, enveloped viruses are much more sensitive than non-enveloped viruses like norovirus, and we just don't. Now it's really interesting. We saw with the original SARS virus, it could be spread via fecal plumes. There's an evidence in a hospital, in an apartment building that wasn't properly plumbed. People would shed the virus in their feces. They would flush their toilets, and then that would re-aerosolize the virus from the feces. I think that certainly could be a possibility. And we know with SARS-CoV-2, you can find it in water treatment plants, right? In the inputs to water treatment plants, that's a possibility. But I think obviously you can't prove a negative. You can't prove that it's not transmitted by food. But I think if it was transmitted by food, we would see different. We would see outbreaks that were more definitively food linked instead of ones that were aerosol or droplet linked. So again, can't rule it out, but I think on the probability game, I would bet against it. I just don't think it is at all likely.
As a follow-up to that, we did have oh, sorry, go ahead, Peter.
Yeah, just to add on that, it was also a big question during SARS-1, and unfortunately at that time we didn't invest enough in the needed research, and here again we are unfortunately a little bit in the same situation, although we have already 2 studies looking at the ingestion possibility using model animals. They have not yet been published, but both seem to indicate that that's a possibility, that you could induce infection through ingestion of virus particles in model animals. Whether this would be relevant for a normal food ingestion in a human body, that remains to be seen. But I think it's an area that is worth exploring. I agree with Don that if it was a major route of infection, we would have seen that. It's clearly not the case. But again, as we move into a situation where we will eliminate, hopefully slowly, the vast majority of respiratory transmission, perhaps we should pay a little bit more attention as some of the other more minor route of infection of this type of viruses, whether it's through fomite or potentially through ingestion, to better understand what are the risks and what really happens in this kind of environments. Just again to get better understanding and get better prepared for how to handle these viruses in the future.
Well, I want to go back to a comment that was added to the question we had about differences between fresh produce processing and meat and poultry processing. Because I think it connects to the sort of morphology of the virus and Bob's question. But would either of you be able to sort of tackle a possible explanation for the meat industry to be affected more than the produce industry? Is the virus being a zoonotic one and being in an environment with more animal cells versus an environment with more plant cells? Could that be part of the situation here?
I think that's a really interesting speculation, and that actually might be the kind of data that Food CoVINet is going to produce, right? Specifically, some of the work that Byron is going to be doing with meat. So yeah, it's a really interesting hypothesis. I had not thought about spinning it that way.
And we have one sort of last one here for Dawn. What do you think the chances are that the virus will survive, more probability for spreading in a cold room versus in a kitchen?
Yeah, I would refer the person back to the paper by Laurent Gillier and many other French colleagues and myself as the token American. But basically, the colder the temperature, the greater the chance of survival. And so assuming your kitchen is at room temperature, it's not going to survive as well.
Cool. And then the last comment before I end things off here is from Bob again, just a reminder that Hep A is not enveloped and foodborne, while hepatitis B is enveloped and not foodborne.
Right, which is consistent with what we said, right? Like that enveloped viruses are fragile; they don't survive the stomach well, right? I guess the one thing that might be interesting is, could you get infection through an ACE2 receptor in your mouth or your esophagus before it got to the stomach? But again, we're getting off into the speculative weeds with that.
Absolutely. But I want to, and I'll share my screen as we end things here. I do really want to thank both Peter and Dawn for sharing their time and insights and just being part of this discussion. And today, I think we answered all the questions that came in. I appreciate that, but also just the candor and the conversation around this complex issue. And you know, Peter, we appreciate you joining us today, and Dawn, as always, I appreciate your insights and thoughts around this. But before we close, for those of you who are still around, all of the information that we produce through Food CoVINet is available at foodcovi.net. And that includes the video recordings of this webinar and also past webinars, our extension materials, and this will be a place that we'll also be sharing results of the research that we are conducting. And so again, I just want to, on behalf of our project, thank Peter and Dawn and our attendees. So thanks, and I think we'll end things there.